February 19, 1994, Riverside, California. The clock shows 20:15 in the evening. The city is quiet, the air is cool. But as an ambulance sped towards the emergency room at Riverside General Hospital, a nightmare that modern medicine still struggles to explain is about to begin. This was not an epidemic. It wasn't a virus or a bacteria either. The patient who entered the emergency room that night, Gloria Ramirez, unknowingly carried a deadly weapon in his body. It was such a weapon that doctors who touched it or even breathed in it would collapse on the ground one by one. Within 45 minutes, the emergency room turned into a battlefield. Patients were evacuated to the parking lot. Doctors had a stroke. And that night, Gloria Ramirez was etched into history not so much by his name as by the terrifying nickname that was given to him: Poison Woman. Today, in the Onyx Able file, the unsolved secret of Gloria Ramirez, the woman who quarantined a hospital single-handedly, we examine the missing organs and the covered-up facts in great detail. Before we get caught up in the horror of the incident, we have to remember who Gloria was. She is a 31-year-old mother of two, a woman full of life. He is loved by those around him and is fond of his children. But by 1994, Gloria was fighting a quiet battle. The diagnosis was dire: advanced cervical cancer. The pain was unbearable. His family was trying every way to ease his pain. That evening, when he collapsed at home, his heart was beating irregularly and he could not breathe. His wife immediately called 911. When paramedics arrived at the house, Gloria was unconscious. An oxygen mask was immediately put on and intravenous access was established. Everything was according to standard procedure. No one noticed the signals of the biological anomaly that was about to occur. It was 8:14 p.m. when the ambulance arrived at Riverside General Hospital. Gloria was immediately taken to Trauma Room 1. In the room, Dr. Humberto Ochoa, physician assistant Julie Gorczynski, nurse Susan Kane and respiratory therapist Maureen Welch. Gloria's heart was about to stop. Doctors administered a cocktail of Valium, Versed and Ativan to keep him alive. This is where the first strange thing started. When nurses took off Gloria's clothes to attach defibrillator pads, they were shocked. His body was shining. His skin was covered in an oily film, as if it had been dipped in olive oil. This wasn't sweat. This was something else. A strange smell began to spread in the room. Some likened it to the smell of rotten fruit, while others detected a strong garlic odor. Doctors tried to attribute it to diabetes or chemotherapy drugs. But they were wrong. Around 8:45 p.m., nurse Susan Kane drew blood from Gloria's arm for blood gas analysis. When he held the tube up to the light, he couldn't believe his eyes. There were manila-colored, or yellowish, crystals floating in the blood. The blood should be liquid, without particles. Susan Kane handed the tube to the doctor and said, "I don't feel well." Seconds later, he collapsed to the ground. They took him out of the room. Immediately afterward, resident Julie Gorczynski began to feel nauseous. "My face is burning," he said. He collapsed into a chair and lost consciousness. The dominoes were starting to fall. Respiratory therapist Maureen Welch was the third victim. Everyone in the room was shaking, gasping for breath, some temporarily paralyzed. The hospital administration gave the code, internal disaster. The emergency room was completely evacuated. patients began to be treated on sheets laid on the cold parking lot concrete. Only Gloria and a few brave doctors in hazmat suits remained to try to keep him alive. But at 8:50 p.m., Gloria Ramirez died of cardiac arrest due to kidney failure. But the real fear started after he died. His body was deemed so toxic that no one could approach him. Dr. Gorchinsky, who was the most severely affected, spent 2 weeks in intensive care. His condition wasn't just a fainting spell. A vascular necrosis, or bone decay, began in the leg bones. A healthy doctor was at risk of injury from breathing a patient's blood. This could not have been a simple, psychological reaction. So what happened that night? The Ministry of Health dismissed the incident as mass hysteria. But at Lawrence Livermore National Laboratory, nuclear physicists had a much scarier theory, DMSO. Gloria had been applying a powerful solvent gel called DMSO to his body at home to relieve his cancer pain. This gel explained the garlic smell and the oily film on the skin. DMSO alone is not lethal. But when combined with the pure oxygen administered in the hospital, its chemistry changed. Oxygen converted DMSO to DMSO2. These were the crystals seen in the blood tube. But the real disaster happened when the shock device was activated. The change in electricity and blood turned these crystals into DMSO4. That is, dimethyl sulfate. Dimethyl sulfate. A powerful chemical weapon used in World War I. Gloria's body had turned into a living nerve gas factory as a result of the drugs he had taken and the hospital intervention. This is what burned the doctors' lungs and rotted their bones. Although this theory is very scientifically strong, it has never been fully proven. Gloria's family didn't believe it. According to them, hospital staff had made a mistake. Some even claimed that there was a secret drug lab at the hospital and that Gloria was given the wrong serum. The saddest thing was that Gloria's heart and many of his organs were missing during the autopsy. Was the evidence destroyed? Or have they just rotted away? Gloria was buried in an unmarked grave in sealed plastic bags months after the incident. The Gloria Ramirez case remains one of the greatest mysteries in medical history. Do you think this was a chemical accident or a dark secret of the hospital? I'm waiting for your theories in the comments. Don't forget to subscribe to Onyx Able. See you in the next mystery.